Normally you see my screen. I'm here with the authorization of all these networks I'm working with, and I just described. And as you have perhaps seen in the title, I wanted to mention not digital commons, not only open health, but operational commons. And I try quickly to explain why this is important to be operational in the field of health. So if we remember in February 2020, uh, things were suddenly crazy. I mean that uh, as makers, we are usually connected to international information sources, including databases of objects and designs. And we had naturally many information coming from China, Asia, and south of Europe for us. And in less than 3 months, we were in a world where everything changes. So what was very strong, you can see the first picture. The first picture is a nurse, a French nurse. And as you see, the French nurse is wearing a trash bag. She is wearing a trash bag because you have nothing else to wear to cure the people in the French hospital in February in 2020. Online, we have Prusa, the famous Prusa of the open source 3D printers, who put online the model of the personal protection equipment that was made everywhere in the world, and all the designs were put online when the people were trying things to help the others, and when the states didn't have any responses to give to the people. What was very interesting for fablabs and the network who is thinking the idea of the Fab City from 2011 was that even if you have money, for example, if you are an hospital and you have money, you can't have anything that you buy in China or anywhere because you have no planes. It means that very quickly in the hospitals and the places, you have no stocks. So what? And what many things happened were very interesting in different timelines with mobilization of different actors. And the first thing who is very important in this context is clearly the proof by making. And this proof by making make in real world the idea of distributed fabrication of common goods put on the internet in the form of digital commands, designs, plans, and so on, a reality with some limits, but with some actors that are not official actors, that are mobilized usually by the caregivers, the hospitals, the states, or the actors of the health and the public health. For example, in France, but not only in France, in all the countries, the first people who were makers using plants that are non-exclusive everywhere were not the Fab Labs, were not the people using 3D printers. There were citizens that were sewing masks. These people were everywhere. They don't know the Fab cities, they don't know the Fab Labs, but what they made was using these digital commands to make with local materials millions of masks they distributed everywhere, the public sector, the health sector, or anybody couldn't give anything to the fragile population and caregivers. What we saw also was many people in France, about 10,000 people, people who are not uh, Fab Lab promoters, but who are equipped with 3D printers, using these 3D printers to build together around platforms, online platforms, in their villages, like the sewers, personal protection equipments everywhere in France, Europe, and in the world. And some people emerges from the social networks or the territories. And for example, in France, you can see the face of some people, and these people, they are not professional, they are not makers, they are not fablabs, but they are something like 10,000 members in 15 Facebook groups, and all these Facebook groups were organized around local meshes, like 18 kilometers meshes that were the size where you could find materials and people to help around them. And they were organizing like decentralized node of solidarity networks, trying everywhere to find materials and guidelines not to kill the others with bad devices or bad cleaning of the devices. Of course, the Fab Labs were on the front very strong. I saw myself in France, for example. We are in the world, the country where you have the most, the biggest number of Fab Labs per inhabitant, something like 230 Fab Labs. And all the Fab Labs, they were trying to find the good information, to find the materials, but also as we didn't have the right to move our car outside of our houses or open the lab to build things, they try to find papers and legal ways to make good things and to address these things to the good places. And for example, we've got a database here in France with more than 350 press papers, especially local newspapers, about solidarity action of these networks. What is very interesting is that the proof of the distributed fabrication of digital commons on the field using local materials by not the Fab Labs, but the people who want to work together, especially called by the caregivers, is not a fiction. It's a reality that has been proved during this crazy year. And I think that this proof is very, very important to change the mind of the companies, public sectors, governments that didn't think it was possible, even if we always thought it was possible. I'm used to call some of these strange health objects that have been made during the coronavirus crisis users, like unidentified solidarity objects, because many of them didn't exist before, and many of them had not a clear status, legal status, medical status, certification status, health sector status, and these objects finally were not made in the without white lines because there was a chain in which caregivers, hospitals, um, many people tried not to kill, trying to save. So the impact of the first wave during 2020, not for the oxygen concentrators, not for the repairing pieces, just only for the PPEs, I mean personal protection equipment, was estimated by some great initiatives like open source medical supplies we made during 2020 uh, at about 75 millions of supplies delivered by about 2,000 local groups by 72,000 people um, on using digital commands and using local materials. This is something totally crazy that you could think was totally impossible before. And this is something that does not only involve the Fab Labs, but that involves people who need, people who design, people who control, people who certify, and people who deliver, and people who use in kind of chain. So I give some example of the importance of the idea of open health, and after this, I speak quickly about try to give a definition. So, for example, in France, what was very interesting is that you had meshes of about, I said, 80 square kilometers, because it was corresponding to the people who were walking around them and who could put in their car some devices to go from one place to one other. You didn't have the right at the beginning to go in a more to take your car and to move if you didn't work for public or emergency services, and only the people who have authorization can move. And remember, you didn't have any plane and you couldn't take the train. These people, they were federated with the local mayors or the local people or the local associations who were used to help the others around caregivers before, and then after with a social society of, for example, the places where you have the seniors, elders living without any protection, or disabled people living without protection. And then after supermarkets, when the people were walking, all these people were not addressed by the states because the states, they couldn't answer because they didn't know how to answer, even when you have money, but when you don't have planes and you can't have anything that you want to pay that comes really on the field. We saw strange things happening. For example, on the second picture in France, you've got the first professional 3D farm installed in the public hospital of Paris. They set up these crazy projects in about 1 week. This 3D printer farm was dedicated to 3D print the pieces needed to repair all the medical devices in the hospital. Remember, you can have everything you want to save somebody. If you don't have the little piece that push the syringe for the person, nothing is useful. The person dies. You can't buy repair pieces because you have no planes. So this initiative, which was an initiative of the of the Paris hospital, was linked by the French Fab Lab networks, not with the Fab Labs, but with the makers who were at home. It was linked also with a pool of developers, 2,000 people designing things on the needs of the caregivers, which is called Just One Giant Lab web platform. And this is something that we never seen, is that they accepted to give good informations and certify models, very simple models that not only companies, not only big fab labs, but also real people with 3D printers could print with uh, medical papers saying how to clean it, how to make it, and how to use it. You've got a strange image at the upper right, which is the Maker project. The Maker project is also another kind of initiative in which you've got people who are in a software startup stopping working to develop an open source respirator. Um, and this respirator is not 3D printed. It's a very complex object, totally open source hardware that is and was built with um, car industrials, aeronautic industrials. And this kind of project is totally interesting because they decided that the result of the research and the objects are not property of the companies. They are in the common good. It takes more time than to make PPEs, you know. In fact, it took about 1 year, and the 200 first open source respirators of the Maker were sent to India last month. The, the organizations who were in charge of the certifications of the medical devices were totally lost because we didn't have the time to save the people waiting for their certifications, as the certifications are built to make very serious things with organizations that have many money to take many time to find big solutions in the broadcast mode. I could speak of many of strange cases we saw emerging, but what is very interesting is the question of the ability to find real ways to set up what I could call not distributed fabrication in a maker model or in a fab lab model only, but a multimodal distributed fabrication in which you can have a process where people, fab labs, small companies or big companies can legally use all these digital commands to make it locally and not to import or to export them. One thing that was also very interesting was what we saw in France with actors who didn't ever speak or know about digital commons, open source hardware. I give just two examples. This is Yves Rocher, who is a leader in the cosmetic industry here for many years. And when they decided to help, they took the World Health Organization gel formula to make it and to give it to the hospital. They didn't try to make their own formula or to sell it. They take something online, and as it was so easy, they made it at a scale that is a scale that is very difficult to make for little associations. When a doctor of one hospital in France gave to the nurses a PDF document that was put on the web locally with the way to uh, build and sew a mask. This mask was made by the people working in the T-shirt trademark Petit Bateau by about 100,000 unities in less than 2 weeks. In the same time, the people were sewing them in the villages. So it seems that breaking the enclosures and intellectual property, or not breaking it, but saying sharing really and legally things in digital commons is not only something for makers or alternative actors. It means that factories can really reprogram their machines to build things that have sense when it is needed. And especially they ask the people working in their companies to come to work again in the companies in the Sundays, Saturdays, all the weekends when they are not working and they can to save the others. So we have different timelines of different actors making what we could call beginning of an open health distributed chain. This makes us discover some kind of loops. I say loops because often when you want to improve a process, you've got something which is iterative and in which you can improve at each loops and take inside other inputs to improve the processes and come from call from caregivers to conceptions, depending of the call, to selection of what has been designed and concepted to prototyping in real life that make the hospitals and the other being able to test it and makes clinical validation at different level, local, national, international, big problem in open health question. And then we can uh, give to the world guidelines, documents, and files that explain to the people where and how use the things not to kill the others. This can address different kind of objects and complexity of objects and materials depending of the actors who are targeted to be on the field and really distributing, making, and using this object. So I don't have the time to give the detail, but we set up this kind of chain in France, and now We tried to set it up with African friends and fablabs, and it worked legally in the exception laws who were in France during the emergency crisis and period in 2020 for about 27 days. And it worked very, very well with Paris Hospital, Just One Giant Lab, Facebook groups, French Fab Labs, companies, and platforms. So we have a problem, I think, because during 2020, many objects, research results, data, source code, designs were put online by many great people. But it didn't really change the things on the field. I mean that it's very strange when you imagine you have a balance, you imagine you have the cause, and you've got the effect. So you improve the cause, and the effect should grow. But when you put more data online, more plans, more design, more good people in the field of health, you don't have really the effect growing at the same time. For example, we have 100 million of people in need of prosthetics in the world. You have many plans and designs of many prosthetics in, and more, but you don't have many factories who have the right to build them legally because it's not certified, because the people who are in charge of the prosthetics market, it's not very interesting to them to have little things, frugal things made on the field with new laws that open this new path of sharing the health. So we have a problem. It is that we can be very happy to put data online to make open research, open science with people who is diplomas. But the real world which is addressed is the world of the real people in needs. And the people now, we are not sure that there is a real impact on their life until we find a way that legally we can and internationally share what is found or design what is found so it is democratic and it can be rebuilt legally on the field, especially in the South country. So I will be perhaps, it's not very fun, but for the moment, I think that after 2020, especially when the PPEs were forbidden to build after the heart of the emergency period, I think that we are not we have a problem that is that you have in the health sector and especially in the health medical supplies or devices, you've got a market response. The result of the market response is not so good at the worldwide scale in terms of diversity, equality, and access. It is a response who, who wants to address people who can afford. And in the world, you don't have so much people who can afford solutions made by North people for North people, for example, or by the people who get something like 90% of the cost of an object, who is to take back the money of the research and development on these devices. At the other side, we have the top-down rules to follow. For example, when your government say PPEs cannot be built or you can't wear them, it's not useful, but you have to wear a mask. It's good to wear a mask, but what is your choice as a citizen? Your choice is to follow or not the law. That's all. So the people choices, the people creativity, the people ideas, the people needs, the link between the digital commons and the processes I tried to describe before is not in the actual options, major options. And I'm afraid that we must take our responsibility to find other ways that these only two options to make the people involved in their own solutions, even if we do imagine that we will need a lot of them. So I'll try to perhaps a definition of open health, like we try to define it with the French Fab Lab network and the African Fab Lab networks, is simply linking the needs of the populations and the caregivers to non-exclusive solutions. It's very important. And that solution, these solutions, they are not made to be high technology solutions, but to work on the field, to be in the common good with one objective that is not only Fab Lab or maker or society tinkering fabrication, but also multimodal distributed fabrication. It means that you've got collective of united citizens, like enabling the future. You've got Fab Labs. You've got little, medium-sized industries, companies. You've got many, many actors. And when you design something, you must take care of that if you want this to address really the real world. It covers not only the PPAs or medical devices. Healthcare is something very important in philosophy. It's not only, your body, it's what happens before you are sick. So it means prevention, it means hygiene, it means how you are monitoring the pandemics. It means how you are caring the people who are something one time, and how you take care of the people who are sick for a long time. So it means that it's not only open science online in biology, hardware, human science. It's not only the design, it's also the validation that makes it legal, the medical certification, the interoperability of the solutions found in different countries. If you are a humanist, it has legal, very important legal aspects. It means databases of the solutions and access to this solution and classification. It means healthcare facilities, and it means also repairability, because repairability is not very interesting, for the actual market, for example, in disability ecosystem. So just to finish, and I hope, Florent, I can have 5 more minutes. Thank you. We had in this context a kind of perhaps many people who were out of the lives they have every day to address something that they can think immediately to be one challenge for the whole planet with sense and fraternity, the needs of shared solutions that are non-exclusive without being an outlaw, and we made it together. So this is clearly something that is a question in the mind of the people between cooperation or competition. This means you have organizations that are specially adapted to address things that break the walls that you could have, for example, between states in a world of competition. So I noticed that there were organizations that were addressing this kind of challenge before the coronavirus crisis, like Enable Network, like uh, Juggle, just like Giant Lab in openscience ecosystem. And now there are more that have understood that we are nodes of a mesh and that this mesh should be worldwide. So I say M19 initiative in India, enable all over the world for years, open source medical supplies, or the Red International maker on ourselves. So to finish, do we have other challenge on the whole planet to help each other that we are in need to solve together that can't be solved in a place only or a state only? Yes, we do have, yes. We do have with the climate change, because now one of the lessons is not only we must build the chain of the cooperation in different nodes distributed and working, and that the physical meshes are something like perhaps 50 to 80 kilometers around the places where the people live, not only the fab cities, but only everywhere, sorry. But in the certainty of a certainty, we have a responsibility as Fab Labs because we are experienced to make almost anything and most unpredictable project every day worldwide. So who else can face what we can't predict and what will happen depending of the climate effects? So we took 3 initiatives to finish, concrete initiative during this crisis in the French African Fab Lab networks and in the CC Lab Association. The first one was to say we are not here also to teach the people or to build almost anything. We must assume the sense of our actions, and we define three priorities until 2024, which are the open health as defined before, the diversities, sexual orientations, gender, races, origins, and the environment, of course. So we are launching an official pilot of open health with a French hospital before the end of the year with three axes of practice, very simple: repairing PCs, catalog and printing, vertical application for surgeons using imagery and 3D printing to prepare the operations before they must work on somebody. And of course, inspired by Enable and My Human detections uh, uh, from patient to maker, people, disabled people, making themselves their technical apps using open source catalogs. The second initiative was launched without money in March 2020, and now it involves 10 Fab Labs in 7 countries of West Africa with uh, French-speaking African Fab Lab networks. We have 2029 euros project launch, and for the moment, 20,000 objects were built and given and used in Mali, Benin, Senegal, and we will continue until 2023 with a special program that will use a precious plastic machine to recycle plastic to make open source medical devices in West Africa. And its launch, you can look at the website. It worked very well. We have great news in about 1 month about the funding of this project. And the second one is North-South Adaptation Forge. I am launching with the CC Lab. And what is very interesting is that it's not only a Fab Lab network initiative, so the object is to document 106 workshops formats to be played outside of the Fab Labs, to make the people being aware that they have the power to find other options than top-down guidelines or than market options to find solutions to the climate change effects. And so it means that we want to address, using the lessons of the coronavirus crisis, the health of the world. So if you are interested in the project, I don't have the time, you can find the website here. And we also have excellent news in about November about the launching of this project you can be involved in, and which has exactly the spirit of creating processes and chains like I described in the Open Health in France or in the Open Health definition. So the question is, your lab a tea bag? You know, when you put tea in water, what is important is not the tea, it's the result. So if you want to only work on the quality of the tea, it's very interesting and useful, but be aware of it. If you want the tea to change the world or to change your territory, you must ask yourself what what is your water? Is it your territory? Is it a thema? Is it the world? What are you infusing and catalyzing? And not only concentrate yourself on the elite quality of the things your Fab Lab provide for himself or his member. So make an hybrid of choices and assume you have the choice of being in the competition and assume, or in the cooperation and share and assume. In the exclusivity, your lab is very good and work for exclusive results and not for common good, or the goal of your lab is to find solution in the common good, especially in health or depending of climate change effects, assume it. You want to make only elite project or you are inclusive? You want the people, unemployed, retired people, disabled people being in your project? Okay, be conscious, be aware, orient your project with that. You want to be market driven only, or you want to explore sustainable economic models, alternative models? You assume it. Okay, don't close your eye and say I make my work. Okay, you are responsible. You are today in 2021 in the real world. You are a Fab Lab center or you've got an holistic approach like the T-bag one. It's very important to me. I think Thomas Diaz had an excellent idea with the Fab City concept in the 2012. Now, we have also this question in many fields, and you must ask yourself this question, or working for yourself and your community only, or having an effect on the world and your territory linked with the others. And also a philosophical question, even if you're an engineer, do you believe really in techno solutionism problem? Who is funding your techno solutions? Who will be using it? Is it desirable and is it democratic in the choice of what it provides to the people concerned? So I thank you a lot to have the patience to support my very bad English. And I dedicate this conference to one of my best friends who died during the coronavirus crisis, which is named Jean-Marc Ferron, who is a great contributor who catch for us all the press articles using open source code during the coronavirus crisis. I thank all the organization for hosting this little conference, and I invite you to join all the citizen forces who want to find other ways that those, the way of the market only, are following guidelines to invent and create a world where we could address new, many little scale and at a big scale, little challenges at a big scale. So I thank you, and I hear your questions if we have the time. Florent, John.
Moi, c'est bon. It's good if you want to ask question. I have the time for me.
Okay, so you've got the. Don't hesitate to speak. I see, John, you are here. I know you have many ideas about the organizations. You spoke about the no-nos some years before. So take. You can speak as everything will be registered. And if you have anything to say, so don't hesitate.
Thank you. I thought that was a really good overview of what's been going on. Your attitude towards established institutions is of interest to me. I find myself thinking these days that our well-established institutions have failed us, that the regulations that you say need to be changed actually just need to be circumvented, that we need to figure out, and we can figure out ways of going around them. And actually, I'm giving a talk that I need to prepare in a few hours, which argues that we should really consider ourselves a plan B as all of our organized systems break down. They won't necessarily break down, but frankly, they are failing us pretty severely. And what their attempts to fix the solution may actually be in the wrong direction. So it seems to me this network that we're talking about needs to work with organized institutions when we can, but frankly needs to be open to the idea that we really need to go in other directions as well.
I myself, I try a lot to work with traditional organization and to try to change the way actors work together, because we are working in a world where you have an history and an experience and forces of all these actors. But one of the problem in my mind is the competition culture and the way the people evaluate their interest to make some things or to encourage some things. And sometimes, you know, I take perhaps a bad example, but if I am building houses worldwide with a huge group, a war is better for my business. You know,
What is better for your business?
a war, because if you've got bombs, I will build many things. Okay, so this is something that is historical, and that many historians studies that, and this is a real present problem for the present now. It is that the question on the way you evaluate what is a success for your organization is really critical, because if you have the same criteria, like for example, uh, mm, mm, economy, only just business, just dollars or things like that, it means that in the future, we should have little bit of winners, the winners who will afford oxygen, who will afford health, who will afford virtual worlds, who can go in the good places with health, and the others, if they are not people who can afford, finally, you don't need really them. So I think it's very important to think that health is something that is not only a technical question, but a philosophical question. And what you mean when you make take care of the planet or take care of the people is not only an economical question. And what is very important now, it is that the people are aware that the challenge that we must address can't address only affordable people or a little percentage of humanity that is in kind of north countries or elite, solutions, even with great technologies, even with great process, even with great data. So what I hope is that the these old ideas of humanism or planet or global conscience uh, could be today linked with operational commands that works and that have proven that they can work, so we can build other futures that can be um, good futures, not just resisting to bad futures, but imagining how to mobilize people. And the other thing I want to say is that many initiatives are addressing by the states or by the companies are addressing the people who are the people who are working, because the people who are working, it makes the economy work. But you've got many retired people. They have energy, they have knowledge, there are networks, there are many in the citizen collectives and in the Fab Labs, the children's, the disabled people, all these people, there are many, and all these people, they are in the world. And I think that in this kind of dynamics, we can involve a lot, and that it is also a challenge for diversity and peace. So somebody else want to talk before we close? I'm sorry, but the timing is short. Zaid, Jeffrey,
Hi, can you guys hear me?
welcome.
Hello, thank you. So my name is Zaid. I'm I'm an emergency doctor in Boston. And apologies, I'm kind of sleepy because I just got off my night shift. But so in our experience in Boston, we sort of went through the same thing where we had disruptions in our supply chains, and we had to rely on our local fab labs to sort of come up with solutions to some of the challenges we had. But one of the sort of the problem we're running into right now is as we sort of reach a plateau in this certain pandemic, although that's debatable. And while the next sort of big challenge to healthcare around the world is sort of brewing, we run into the issue of not being able to, how do we democratize the verification and like the quality control of the things that we're creating? Because that's the issue we have, especially in health, is that this is potentially something that's affecting somebody's life. And if it does go wrong, the price is very high. So how do we make sure that the things that we're producing are of good quality and can actually do the things we want them to do?
So we saw also many things that are being made today in France, in Europe, and in the States, when you've got makers and fab labs who are trying to work with companies using digital commands, but with new processes. When you've got unique identifier, laser engraved or 3D printed to trace every piece of supply and to be sure it had at least a quality, I think the world now needs a kind of group seriously working on the indexing and sharing the methodologies of the experimentations. I know, for example, in France, 3 projects working after the 2020 coronavirus period on this question of quality, of digital fabrication, both by companies, but also by the cooperatives. And I think it is also especially companies, of course, of open source hardware, but also addressing collaborations on very simple devices like repairation pieces, and inventing ways to certify the quality of these pieces with unique numbers and so on. But the main question was the process of medical certification. For example, in France, when even with the emergency law, we who said, okay, we must save the others, so you can, in a region of France, so a region is perhaps something like 4 million or 3 million of inhabitants, the regional hospital can certify one device to be used after quick tests on some of the emergency classes of medical devices. In France, you have three. Class 3 is lethal. Class 1 is everyday, little objects like to push syringe or things like that on pieces. Even in France, when you have the authorization in the south of France, and you've got in the north of France people who can die the week after, there was no law or process to make it interoperability between the certification in the south region and in the north region. And not on the lethal objects, but any objects used in a hospital. Nobody spoke about this before because never had the need to address this in this timeline. After that, you've got the official certifications that is made to make the companies to have the authorization to sell things. We know all it's something that is very expensive. It's something that is very closed, and it's something that is industrial. And usually the time was 3 years. In France, projects like Le Maker, open source respirators, could break these delays with the help of the French states to 1 year. Even if it has a certification in Europe, this certification is not good for USA, for example. All of this, you take this. You've got the coronavirus crisis. You're not speaking about maker. You're speaking about health system. You look inside and you say, "Oh, no databases of the pieces in stock in the hospitals to know if they can give one hospital to the other the pieces that are not in stock to save the people because nobody thought to make a database interoperable with all the stocks. Oh, no way to have interoperability between international because it was made to protect interest of companies on markets with long terms and so on. So all of this can be today, or must be studied, shown, and patched with or without fablabs and makers. But what is very important to me is that we want progress on the field to make millions of people access, for example, to frugal innovation solutions. And it's very important because you prefer to have frugal innovation working than nothing, or something you see on the internet or on the TV because you are in Bangladesh or I don't know, Haiti. So I think that today I see many people are very happy to put online great research results, but they don't care that it exists in real life because it's not only a question of design. It is a question of legality of these certifications. It is a question of, if, for example, who wants really the African people setting up companies to sell low-cost prosthetics by using the tools they use to repair the bicycles with all the rights, with those patents, just, like you can make in your own country, for example. So these questions are questions that must be addressed, I think. And I think that if we can address the answers to these questions, who are very important in the medical field, because you can't kill the people trying to save them. In fact, with the medical supplies, usually you must be very careful. It means that we can solve it for many low-class objects, non-lethal objects, useful objects for many needs. You have for many solutions you need. And so I think that really this question of open health can be something that open many paths for something else than medical supplies. And so it's very important to work on it, because when you can solve things depending on all these things, certification, building, stock, guidelines, interoperability, digital rights for medicine, it means that it's easy to use it for, I don't know, for example, the heat in the climate change effect in places with little objects, or for reparation pieces, or for frugal innovation. That's why I think we have a responsibility to push further what can be done in this field. And I'm very happy to see that it's not a maker question, but that it is a question that can be addressed now with different responses. And one of the things nobody speaks about is that, for example, you don't have an internet neutral. How are you sure that even if I want to share something in the common good of humanity, the other can just click and see it? No, you won't see it. Who is fighting now for this? Who thinks, like John said, that perhaps we should maintain a plan B that can be invoked? Today, all the FabLab network, if you cut a natural internet, a big part of the potential of the 2,000 places that work together every day, updating solutions, without speaking about operational commands, just the solution, digital solutions, falls. Who is fighting on planet Earth after coronavirus crisis on this old fight that is called, for example, neutral internet, interest for humanity? Who are the doctors fighting for it? FabLabs fighting for it? So there are many simple things that can address a kind of warranty that we humans, caregivers, and people have the right to share solutions that can really work on the field, because we don't want to break the market, we don't want to break the government. We want other paths to be effective, and I'm afraid we'll need them. I thank you a lot. I thank you everybody for this conference. John, I wish you a lot of success. I'm sure yours will be great. And I thank a lot FabSays Montréal and our French-speaking friends of Montréal, Monique Chartrand and community team, and up to everybody will be concerned and involved to open new options of transforming digital commons into real life, and be sure